Welcome to the PD Pet Care Vlogs. I'm Dr. Cath Watson, and today we're going to talk about UTIs in dogs. Now, UTI stands for Urinary Tract Inflammation or Infection, and I say "or" because it's not every time that a urinary tract infection is actually an infection, and in fact a lot of the time we're talking about inflammation in the bladder that may be caused by other problems like stones or crystals, polyps, that sort of stuff. So it's really important to understand that from the start, because by understanding that, if we're talking infection, we're talking bacterial, in which case we're talking antibiotics. If we're talking inflammation, then it's usually some other management technique to try and get the inflammation to resolve or resolve the problem completely. So as far as inflammation or infection, it's much more likely in female dogs than it is in male dogs, and that's purely an anatomical issue. So females have a much shorter urethra, so that's the tube that runs from the bladder to the outside that allows us to go for a pee. So it's much shorter, it's much wider, and obviously it's got a much more open exit, which is into the vulva. For male dogs, it's a much longer, skinnier tube. Obviously comes all the way down around underneath their body. Dogs also have a bone in their penis, which makes it even narrower that urethra passes through. So it's much more difficult for bacteria to be able to travel all the way back up into the bladder. So it's often older dogs that are more prone, and that's just because as we age, there tends to be more damage to our systems, more likely to have other concurrent diseases. And in saying that, things like diabetes mellitus, so sugar diabetes, which usually results in lots of sugar dumped into the urine, obviously makes them more prone to developing infections and inflammation. Some female dogs also have some anatomical changes around their vulva, and particularly in really hairy dogs, that can also make them more prone. If you've got a dog that seems to be getting recurrent infections or inflammation, then definitely worth talking to your vet about, is there anything else you can do to help prevent stuff there. So as far as the symptoms you're likely to see, usually it's needing to go for a pee a lot. And when they go for a pee, often there's very little urine actually produced, so it may only be a few dribbles. You may or may not see blood in the urine. Often if they go on a concrete or whitish sort of surface, you're more likely to. Obviously on the grass, unless we're talking big clots, which is not that common, then you won't necessarily see anything. But often they'll also be licking themselves a lot, particularly for females around the vulva, for the boys obviously around the prepuce. So that's the symptoms you're likely to see. It can also be painful, so some dogs will whimper when they go for a pee or may even cry out. As far as treatment, your best option is to go and see your vet, and like I say, that's mostly because it's really important to determine whether we're dealing with an infection or whether it's inflammation. Is there crystals there? Is there potentially stones in the bladder? And could there even be polyps or tumours in the worst case scenario? So the first thing your vet would normally do is collect a urine sample if they can, because sometimes obviously the bladder's got nothing in it. But collect a urine sample and see if we can determine whether it's an infection or not. The other big thing is, as I mentioned, these are painful conditions. So getting some pain relief on board is usually the first thing to make them much more comfortable, even if that buys us some time to determine whether it's an infection or not. If there's any questions, then it may be a case of doing an ultrasound or an x-ray to rule out things like stones or polyps or tumours. And sometimes we send a urine sample away to the lab and get them to see if they can grow the bugs that are in there, tell us what they are. Common bugs are things like E. coli, but sometimes we get nasty infections like Proteus, which are a little bit harder to get rid of. As far as prevention, for long-haired dogs, or female dogs in particular, keeping the hair around their back end a bit shorter and making sure it stays clean. Otherwise there's not that much you can do other than making sure their general health is good, and feeding a good high quality diet. to try and reduce the risk of things like crystals and stones forming. If your dog has had stones in the past, they often have to be surgically removed, although sometimes can be resolved with a diet. Irrespective, then you need to talk to your vet about what the best long-term diet and management techniques are to help prevent those stones recurring.